The role of the nurse. According to the Health Science Consortium in 1989, the role of nurse consisted of number 1 as a provider of nursing care. The role can be performed by nurses by paying attention to the condition of basic human needs required through the provision of nursing service. The profession of nursing care is carried out from simple to complex. Number 2, as a client advocate. This role is carried out by nurse in assisting the client and the family, in interpreting various information from the service provider, especially in talking concept for nursing action. Nurses also play a role in defending and then protection patient rights, including right to be service, right to information about to disease, right to privacy, right to self-determination, the right to reserve compassion for negligence. 3. Assistance and educator. This role carried out by assisting the client in increasing the level of health, knowledge, disease symptoms, and even the action given so that the client's before chance after health education is carried out. Number 4. Assistant or coordinator. This role is carried out by direction, planning, and organization health service from the health team so that health service provider can be directed and according to client needs. Number 5. As a collaborator. This role is carried out because the nurse works through a health team consisting of doctor, psychotherapists, nutrition, etc. by trying to identify the nursing service needed. Number 6. As a consultant, the nurse actions a pledge for the consultant by planning, cooperation, systematic direction, change in accordance with the method of providing nursing service.
B. Nursing functions. Once independent function, it is an independent function and not dependent on other, where nursing carry out their routine independently, with their own decision in taking action to fulfill KDM. Dependent functions. It is the function of nursing in carrying out their activities on messenger or 2. Dependence function. It is the function of nursing in carrying out their activities on messenger or instruct from other nursing as an act of delegating assigned tasks, usually done by specialist nursing to general nurse, or from primary nursing to executive nursing life. 3. Interdependence function. This function is carried out the team group that are independent between them. The function can also if the service delivery this situation cannot be researched by a team of nursing alone, but also from doctors or other. Nursing is an applied science that uses intellectual skill, tactile skill, and interpersonal skill, and use the nursing process to help achieve optimal level of health. Sudah.
Nursing tips are more focused on the ability of nursing to provide comprehensive nursing care with a touch of art in the sense of certain tips in effect to provider care and satisfaction to client. The tips are caring according to Watson 1979. There are 10 factors in corrective elements, namely humanity, altruism, walls, instinct, anti-Wilson, and hope, fostering sensitivity to self and other, developing an attitude of mentally health, and according and accept experience or good or bad feeling, being able to solve problems and be independent in decision-making, teach and learning principles, account protecting and improving good physical, mental, social, cultural, and spiritual condition, meeting in basic human needs, and being responsive in vaccine and change that occur. Number 2, sharing means that nurses always share experience and knowledge or have discussion with their clients. Number 3, launching meeting that a smile is that main asset of a nurses to ensure the client's comfort. Number 4, caring means that nurses can receive emotional responses from themselves and their clients. Number 5, touching means that physical or psychological touch is sympathy, communication with has meaning. Barbara, 1994.
6. Helping means that the nurse is ready to help with nursing care. 7. Believing in other means that nurses believe the other people have the desire and ability to always improve their health status. 8. Learning means the nurse always learn and develop themselves and their skills. Number 9. Respecting means showing respect and appreciation for others by maintaining kind of confidentiality to those who do not have the right to know. Number 10. Listening means listening to client complaints. Number 11. Feeling means that the nurse can accept, feel, and understand the client's feeling of grief, joy, frustration, and satisfaction.
12. Accepting means that nurses must be able to accept themselves before accepting other people.
As a profession, nursing has important elements that aim to direct the nursing activities carried out, namely human response as the focus of the study, but human needs as the scope of nursing work, and lack of self-care is the basis for nursing intervention. Adhere to them for independence or lack of ability. Nursing is also a series of therapeutic activities or nursing person activities that have a healing effect and health.